Hello, my name is Katie Cueva, and I'm an assistant professor of health policy at the University of Alaska Anchorage within the Institute for Social and Economic Research at the Center for Behavioral Health Research and Services. Today, I'll share a bit about my perspective on ways to improve health equity and cancer care in my home context of Alaska. I also want to acknowledge that I live and work on the indigenous lands of the Dena'ina people. My father's family is from Mexico. My mother's family has been living in Canada for the last couple of hundred years. I also want to thank all of those who shared their stories with me over the years, and that informs my perspective and my work on cancer education and control. And this drawing is by Cassandra, who my mom, Melanie Cueva, met at a cancer education workshop for community health representatives. And she said, "I envision a day when people will be well and healthy in mind, body, and spirit, when drinking and drugs will no longer threaten and tear families apart. Will be when, as Native people, our risk for many diseases will no longer be the highest in the nation, when cancer no longer threatens the lives of those we love and care about. Then that will be a new day. In the Cancer Awareness and Prevention Circle, this is the day we all look forward to. And this day will get closer and closer as more and more people become aware of the risk factors for cancer. The CHRs in the picture are aware of this, and so reach out and grasp the hands of those next to them. They create a link to knowledge and resources found within each other, by each other, so that they learn from each other." So come with me to Alaska, and I'll show you a little bit about my home. And if there's anything I want you to learn from my presentation today, it's to listen to the communities you're working with and hope to improve health equity for. Alaska is home to 229 federally recognized tribes. And we're culturally diverse. We have many different language groups, and we span an enormous geographic area, which I'll show you later. And that diversity means that there's not one pan-Alaska Native identity or one solution that will fit every community. Alaska Native communities are strong, though. There are a number of traditional values that are common and those that are unique to individual communities. And one of those is to pass traditions on from elders to youth. And this is a picture of my mom and my daughter when we were out berry picking this fall. And I think that makes cancer an especially challenging disease. 1 in every 5 deaths among Alaska Native people is due to cancer. And that often means that the individual whose life is taken is no longer able to share that wisdom or share those traditions with younger generations. And especially in small communities, that can impact the entire community, not just the immediate family. There are 3 different systems of healthcare in Alaska: the private sector, Veterans Affairs, and today we'll mostly be focusing on tribal health. So you'll see on this map of Alaska that there's a number of different colored crosses. Each of those is a hospital. The thing I want you to pay attention to is that there are vast areas of land without any hospitals. So how do those individuals get served? How does the inequity of not having immediate access to a hospital get addressed? And in Alaska, we have a rather unique system of primary care, where we have community health aides and community health practitioners, as well as dental health aides and behavioral health aides that are from the communities in which they serve. So you'll see all of those red dots are village clinics that are staffed by health aides and health practitioners. And they're often the only on-the-ground medical provider in their community, although there are also itinerant physicians and other specialists that travel to communities to provide care as well. This is one way to provide care to those rural communities. Now, their scope of practice is quite broad for a community health aide or community health practitioner, but it varies by the individual's experience, their desire, and their relationship with a mid-level provider who can write standing orders for the community health aide or practitioner to provide a certain service. However, sometimes a patient comes in to be seen with an issue that is beyond that community health aide or community health practitioner's scope of practice. When that happens, they're referred often to a hub community, a larger community, where they can receive more extensive services. But even those hub communities don't necessarily have all the services of a large hospital. Our largest hospital is located in Anchorage, where I live. So people from rural areas will get referred to a hub and then transferred to Anchorage if they're in Southeast Alaska. Sometimes they will also be referred down to Seattle, depending on the situation. However, this is like a person who needs care that lives in Arizona or in Georgia being referred to care in Missouri as the closest point of access for someone who can address their concern. Now, another opportunity is to have culturally relevant online cancer education. So some ways to address cancer control is just to provide additional information. And when there isn't access to that information in a centralized physical location, it can be provided online. And these are some screenshots of modules that I had the privilege of working with that were designed as continuing education for Alaska's CHAPS. And in all of the village clinics, in theory, they all have high-speed internet access so that individuals would be able to access this material in their home community just by going on the internet. Another opportunity is in telemedicine. So here's a typical telemedicine referral pattern so that individuals could also access care via telehealth and also telepsychiatry in some regions by staying in their home community or by going into the clinic where they might have a secure access to be able to access services that are provided by physicians who are located in hub communities or in Anchorage. Another opportunity is to provide mobile screenings. So on the left is a screenshot of the SEARCH Southeast Alaska Regional Health Consortium's program, Wise Woman, that provides mobile mammography. It takes mammography screening to several small communities in southeastern Alaska. And on the right is a picture I took of a colleague in Kotzebue, which is a hub community in northwestern Alaska. And there they would bring in providers to have colonoscopy clinics. So for a week or two, individuals would be able to make an appointment and receive a colonoscopy at this hub community instead of having to travel all the way to Anchorage to be seen. But even though I've shared a few different opportunities for equity, to address some of the geographic challenges that we have, I think the most important one is to listen to communities. What they need and what they want is something that really only they can speak to, and to listen to them throughout the process. So both in what is it that's needed, then as that's developed, well, how is this working for you? What could be done better? And what are the challenges? Are there additional needs that we may be able to address? And also really looking at what is culturally relevant care. So even if a service is provided, is it acceptable to the community? Is it what the community needs? Is it done in ways that people know and learn? Are translation services needed? Is transportation needed? There are all sorts of different things that could be barriers to access to care. And maybe there's cultural translators that are needed, which community health aides and practitioners often serve that role as well. I'll leave you with this slide as well, where there are several different links to programs that I've talked about, and the last three are also peer-reviewed journal articles that take a bit of a deeper dive into some of these topics. So thank you for listening to this short presentation. I look forward to chatting with you in the panel. Feel free to reach out to me as well if you have additional questions. This is another piece of art by Cassandra, and her words on this one were, "For years, Native people have used dance as a form of prayer and as a way to celebrate life. There is a movement among Native America to raise awareness of cancer. The dancer represents a friend, a family member, a person we all know. Dance honors the spirit of people. The shawl honors the spirit of hope, while the many colors of ribbon fringe represent the different types of cancer." So thank you again for listening, and feel free to reach out or ask me questions.